cases. So we all are aware what is called as the situs solitus. Situs solitus means everything is normal. Situs inversus means it is inverted. Okay? So inverted means what is going to happen is in the one AVL, P wave will be opposite. Opposite means inverted, of course, but it will be going to be upright in the AVR. Yeah, because it's all about the where is the atrial, where is the atria. So on the basis of the P wave direction, because then you can comment about it, isn't it? So what happens in the situs solitus with dextrocardia? So this is the ECG in front of you. What do you notice? Even now there is echo. Yeah, and even now there is echo. When I am hearing you, it's loud and clear for me. Okay.
But we can hear a small echo in your voice, sir.
Now is it better or is it still same?
It's somewhat better, sir.
Okay, that's a bit strange. Okay, it is good that now it is not there.
And now it's loud and clear, sir.
Okay, good.
Please
Okay,
continue.
okay, wonderful. So what do we notice in this ECG? So if we look carefully, as I had said it, one of the important things to look is in one in AVL, okay, and AVR. So if you look carefully, there's upright P waves in the lead 1 in AVL, while in the AVR it is inverted, okay. Similarly, we notice that counterclockwise depolarization in the limb leads shows Q waves in leads 1 and AVL, isn't it? Similarly, if you look further in the V1, V2, what do we notice? The R waves are very prominent. Yeah? Similarly, the RS complexes in the right precordial leads are pretty prominent as well. How do we see? Is it a D loop or is it a L loop? L loop is for levo, D for dextro. If we notice Q waves in the left precordial leads, this is what is called as the D loop. Yeah? If it will be L loop, there will be Q waves in the right precordial leads and, of course, absent in the left sided. So, as simple as that, if there are Q waves in the opposite leads, so for example, as I said it for the D loop, it will be Q waves in the left precordial leads, and for L loop, there will be Q waves in the right precordial leads. Okay? So that's what it is. Situs solitus. Let's give you a twist. How about situs inversus dextrocardia? What do we notice here? What is happening? So if we look carefully, over here, this is like the mirror image dextrocardia. So the P waves are inverted in one AVR and upright in the AVR. And the QRS complexes and the T waves are negative in the one AVL and positive in the AVR, if we look carefully, isn't it? Similarly, the QRS complexes are all tall in the right precordial leads and diminishing progressively towards the V6. Finally, in fact, we also notice the septal Q waves in the right lateral leads rather than left lateral leads. I'll try to give you an overall summary as well because it can be quite a lot confusing for all of us to be able to keep it in mind. Okay, Situs Solitus, inversus, okay, in both the types. So if we keep a look on the one, AVF and V1, it'll make us, it will make it really, really easy for us to be able to differentiate for all of them, okay? What about the visceral heterotaxy? So, see, I'm such a nice person, isn't it? I always give you the diagnosis as well. But you have to tell me, how do you diagnose this left isomerism? So what happens in the left isomerism is the sinus node is absent or actually hypoplastic. So the atrial pacemaker is ectopic. Therefore, the P axis is going to be abnormal, isn't it? So what do we can notice? We can notice wandering atrial pacemaker, ectopic atrial bradycardia, or even sometimes complete AV block. Yeah. Similarly, what about the right isomerism? What do we notice? So there is going to be bilateral sinus node, and actually there can be like two AV nodes. Okay, so that's why the P wave axis is actually as normal, I would say, and the right sinus node is the dominant pacemaker. So that's why alternating QRS patterns can be seen, which could be due to the antegrade conduction through either one of the two AV nodes. So a lot of times we can notice PSVT, paroxysmal supraventricular tachycardia, due to re-entry between the paired AV nodes. So this is how you differentiate. Okay. So for example, you can again classify them into the clockwise loop, counterclockwise loop. In the clockwise loop, you try to see for the axis. Is it normal? If it will be normal, then you can think of most of the times tough but pink. But if it is right axis, there will be a lot of differential diagnosis. Similarly, you will have to consider. However, if it is going to be left axis, it will be an adult tough. Okay? And if it is going to be counterclockwise loop, again, you try to see for the axis of the ECG. Is it a left axis, right axis, or normal axis? If it is right axis, your diagnosis is limited to DURV, double outrate right ventricle, VSD, or pulmonary stenosis. Otherwise, if it is normal axis, it can be like type 2C. Yeah? So what happens in the ECHDs with the clockwise loop or the counterclockwise loop? If it is counterclockwise loop, if the axis is going to be left-sided, most commonly it can be is inlet VSD or AV canal defects. Similarly, if you notice there is a clockwise loop and there is going to be normal axis, then most likely it can be a small VSD or mild PS or coarctation of aorta as well. Similarly, for the left axis, it can be multiple muscular VSD, okay, with LTGA